Now, I think it's time for us to hear from Dr. Angela Fernandez. And her presentation is, I Went into the Woods, Native Health at the Nexus of Community and Environment. Dr. Fernandez recently joined the School of Nursing as an assistant professor and as a member of the campus Native American Environment, Health, and Community Faculty Cluster. A member of the Menominee Nation of Wisconsin, her research program is built on over 2 decades of combined national and international social work and public health research, practice, teaching, and service, experience with the Indigenous, Latinx, and other marginalized communities in basically every setting, including the Peace Corps. As a clinician, she has worked with interprofessional teams and inpatient and outpatient care and holds clinical social work licenses in the state of Wisconsin and Washington. As a prevention scientist, she examines the role of cultural practices and nature contact as protective factors in the prevention of chronic and co-occurring diseases like mental health, substance abuse, diabetes among Indigenous peoples. Please join me in welcoming Dr. Fernandez.
Thank you for that kind introduction, Linda. It's a pleasure to be here and happy 50th anniversary. This is a major milestone, and just it's an honor to sit with so many wonderful nurses and public health practitioners, epidemiologists, staff, faculty, and folks in the field and beyond, sharing your wisdom and sharing your healing powers with all the world and with our local folks here. So I will go ahead and share my screen and then share my presentation with you. Can you see my presenter view?
We can, Angela. Your closed captioning is on. I don't know if you want to keep it on or not. So
Does that do folks want closed captioning or no closed captioning? What's easier to see or preferred?
It's helpful to not have the closed captioning because the slides are text dense.
Okay. Sounds good. I'll turn that off. Thanks for letting me know. So I am going to get started by sharing my introduction and my language. Posona tanwe makanak mashik maunuyak mamache toak aswisian kenyakio asa totem. Hello to all my relatives. I'm Eagle Woman and I'm from the Bear Clan, and I'm also known as Angela Fernandez, an assistant professor, newly at least going into my 2nd year here at the University of Wisconsin Madison School of Nursing. I spoke to you in the Menominee language, the language of my people from northeastern Wisconsin, and I'm honored and privileged to be here on the lands of Dejope, which you can see behind me, the lands of the Ho-Chunk people. Again, and thank you for inviting me here. It's really a huge honor to be here with you. And just think about the powerful work that nurses have done in my life, the matriarchs in my family that have gone before me, and all the nurses that I have the pleasure to work with. The epidemiological work that Rachel is doing, Dr. Gicule. And you'll find some of my work is very relevant to the things that we've talked about today. So my work lies at the nexus of Indigenous peoples' health within nature, and we'll go into what that means. So just to tell you a little bit about myself, I first learned about this relationship between health and nature as a child. So I was born and raised on the Menominee Nation of Wisconsin. And when I wasn't in school or doing chores, I was playing outside in the woods and swimming in the river. I left home after high school to study social work and public health throughout my education, higher ed. And I worked with Indigenous descendants in the Peace Corps in Costa Rica. And as Linda had said, I worked in clinics, hospitals, community-based health, educational settings, and also had the privilege of working with the Indigenous Wellness Research Institute at the University of Washington, Seattle. And there I worked on community-based participatory research projects with tribal communities across the US and internationally. So all of these experiences prepared me for my current work as a Native American environment, community, and health focused professor here at the university. And during these past 22 years with all these travels, I still came home regularly and remained connected to my roots on my tribal lands and to my family on the reservation. And in all of these places that I've worked and with folks that I've met both here and beyond across the world and in the United States, particularly with Indigenous peoples, I've learned about that common strong connection within culture, nature, and health. I did not get here by myself. None of us did. We all definitely have wonderful mentors, folks in our family, our friends, our community members, or our mentors in our education and our professional careers that have helped us along the way. And for me, since I was young, my dad was my first inspiration for my focus on the connections between Indigenous peoples' health within nature. I took this photo of him when he was checking his beaver traps on our reservation last year. And you can see our reservation in the dark green rectangular aerial photos. So you see how dense our forests are. And since I was a kid, he talked about how he would go in the woods, not only to feed us, to go hunting, fishing, and trapping, and other friends and relatives, which he still does to this day at age 79, but also to find peace of mind, to grieve the loss of family, and to stay away from alcohol. When I showed him the slide and asked him permission to use it, he said to share why he goes into the woods with you all. This is what he said. He said, to stay away from drugs and alcohol. When I was a child, I seen my uncle turn to hard liquor. One day, up and out of the blue, he got back in his traditional ways and quit his drinking and went back to hunting, trapping, fishing, and taking long walks in the woods, appreciating the blessings Creator gave us. He started taking me and my brothers when we were young, and that instilled in us to appreciate life and creation. You can feel the presence of Creator in the clean air, the spirits in the trees, and all the plants down to a simple blade of grass. That was my church, where you can find inner peace with yourself. I saw many of my friends go down the wrong path and did not want no part of it. I saw too many of my friends living short lives and always wished that they could go back to those old traditional ways before alcohol was introduced to our people from the Europeans. Our family and community story is not unique, nor to our reservation, which shares borders with Menominee County in northeastern Wisconsin and still ranks last in health outcomes compared with all other 72 Wisconsin counties. Across the US, American Indians and Alaska Natives have shorter life expectancies and are more likely to die from chronic disease, alcohol, and mental health related causes compared to all other races. And, watching Rachel's presentation, we did lose a few relatives and friends and neighbors this year. And during the pandemic as well, we saw that increase with overdoses due to opioids and other substances, and including some deaths of our loved ones. However, alongside the trauma in our communities is our resilience. We're still here, and our people are doing good work to heal our relationships with our lands and our bodies. In my clinical work, I work with people who experienced a lot of trauma, but were also very resilient. And this led me to my research about historical trauma and also culture and nature. And we know in Indigenous communities, these are crucial to building health interventions and to supporting health interventions that are existing. So what are cultural practices that involve human interconnection within nature? This is an Indigenous way of describing what is called nature contact in mainstream research. Dr. Howard Frumkin uses this term, and you might find his research from the University of Washington, looking at many studies and the evidence, the growing multiple health benefits of nature contact to multiple health outcomes, asthma, depression, cardiovascular disease, diabetes. So nature contact is defined as the interface between humans and other biotics, such as plants and animals, and abiotic elements, such as water, sunlight. And nature contact studies in general, these mainstream studies, don't include Indigenous peoples or account for the relational connection that many Indigenous peoples have within nature. And what I mean by that is, for Indigenous peoples, human interconnectedness within nature is a term that conceptualizes an interdependent, reciprocal kinship relationship within nature. So as I said earlier, these cultural practices that involve human interconnectedness within nature are commonly used as interventions for risk prevention and health promotion across multiple health outcomes. Some examples you can see here are wild ricing, fishing, cultural practices like dance, storytelling, or activism. And the common link is the human contact with more than human relatives, which are, again, those biotic and abiotic elements within the context of a cultural practice. Within many Indigenous cultures, land, water, plants, animals, trees, and other more than human beings are considered relatives. So we see this in our languages. For example, in my language, in the Menominee language, we have animacy. So when we speak of trees and other more than human relatives, we use pronouns as living beings, not as objects. So to understand the trauma Native peoples experience today, I learned about how separation from land has negative impacts on health. Environmental dispossession is a word used to describe the processes through which Aboriginal peoples' access to the resources of their traditional environments is reduced. And since 1492, settler colonialism, wherein European settlers came to stay, brought policies and practices that dispossessed Indigenous peoples from land, including from foods, shelter, language, culture, and identity. Examples include the Trail of Tears or militarized boarding schools, which were, as their founder, General Pratt said, designed to kill the Indian and save the man. And you might have heard of the reports, especially in the past year, of many unmarked graves of Indigenous children that died and were buried behind the boarding schools in Canada and the US. So historical trauma is defined as a cluster of massive group traumatic events perpetrated against a specific group of people with genocidal or ethnocidal intent, and involving sustained and multi-generational cultural and psychological annihilation. Historical trauma is a term that's defines the type of traumas we've endured in the past, like boarding schools, that still affect us today. And that, for example, that include, the water protectors, the assault on the water protectors of the Missouri River from the Dakota Access Pipeline. So that's an example, of course, how this can impact us today. Environmental dispossession that bars access to clean drinking water, which obviously can affect the health of humans and more than human beings. This Indigenous theoretical framework shows how relationships with trauma and resilience can exist at the same time, and how negative health outcomes can be prevented. So historical trauma is a result of settler colonialism and shows ongoing negative health outcomes, which you see here in the purple circle, as consequences of different types of stressors and traumas. This theoretical framework shows how cultural buffers, which are here in the middle, can show resilience and prevent negative health outcomes resulting from trauma. So this is where my research lies. There's increasing research by Indigenous scholars and community members that show the health benefits of cultural practices involving human interconnectedness within nature. And I'll tell you a little bit more about how my research is contributing to that. Previously, the research that I did to build upon what I'm doing now that informs what I do involves this kind of work involving culture-centered and place-based interventions aimed at prevention of chronic and co-occurring diseases across both rural and urban settings. You may or may not know that now over 70% of American Indians and Alaska Natives live in urban places. So we have folks who are living in large cities and rural areas, on reservations, off reservations, but quite a bit of diversity and more folks living in urban areas now than before. So connectedness is one of the terms that we use to talk about how there's interrelated welfare and well-being of an individual, one's family, one's community, and the natural environment. So again, remembering that reciprocal kinship relationship with more than humans and the role that plays across our human health. In much of this research, I've used community-based participatory research. So that's all about starting within communities. We talked about public health nursing, the important role that we have working directly with folks in the community. The power of building that trust to build research and interventions that are effective. And so I had the privilege of working with community-based participatory research projects, building relationships with different tribal communities throughout this period of research prior to coming to the University of Wisconsin-Madison. And so throughout this work, I emphasized the Indigenous peoples' traditional health knowledges. And you can see that in these different projects that I've done across these different spaces. And this involves qualitative and quantitative methods. So, qualitative methods looking at text and words, quantitative or statistical stories that basically tell us different parts of the same story, but that are equally important. And so with that community-based research, we work with the community to drive what are our research questions and what kinds of approaches are we going to use. So the project that I'm currently working on, that all of those 4 boxes of research in my past has led up to, is with Dr. Lonnie Nelson, who has a larger study called the AI Cherish Project. This looks at Native people's sleep health across 10 tribes and 3 regions of the United States. It'll be a sample of about 750, which will be the largest sleep health study, and I believe the only large-scale sleep health study of its kind among American Indians and Alaska Natives. And you often don't hear of American Indians in research because we have such small numbers, and that we often don't end up in the statistics that look across different health outcomes. So this is a very important opportunity. And my particular contribution to Dr. Nelson's study, which builds upon this study, is looking at the relationship between place, culture, and nature, and how that might impact sleep health and chronic disease. So what we've done so far is to develop questions based on qualitative research on interviews from these participants that look at how being involved with particular cultural practices that involve a relationship within nature might affect their wellness or their sleep health. The questions that we developed about how each of these themes on the list you see address the question, how much does participation in cultural practices connected with nature improve the quality of your sleep and mental health or emotional well-being? Include these examples that you see here. Folks talked about smudging, which is a practice in which you take a plant and it's kind of like burning incense, but it's not incense, it's a plant. So it could be sage, it could be sweetgrass, it could be cedar, and you pray with it. So could also be different forms of ceremony that take place outdoors, like sweat lodge, drinking teas or eating from traditional plants, picking berries, gardening, hunting, ranching, walking to the creek, protecting land for future generations, or dreaming about these things. So all of these themes, again, were generated from the qualitative interviews from the participants in the sleep health study. So these are the questions that will go into the larger study, and we'll have some quantitative data from that. The first set of questions asks about sleep health. How much does each of the following Indigenous cultural practices help you get good sleep? And we saw, just as in the previous slide, these 6 practices include spiritual, eating or drinking, work, recreation, protecting, or dreaming with nature. And that's the second set of questions are the same set exactly as the top, except they're asking about emotional or mental well-being. So we hope that this research will help us to understand better how tribal communities are preventing and treating sleep problems that are linked to chronic disease, as well as mental wellness that are related to chronic disease outcomes as well. These questions, as I said earlier, would go into the larger AI Cherish survey. So right now data is being collected. And when the data is ready, my project will use statistical methods, multiple regression analyses, where we look at whether participants live, where they live by zip code, if that makes a difference in the relationship between sleep health and chronic disease outcomes. We'll also look at whether their involvement in cultural practices that involve a connection with the nature make a difference in the relationship between where they live and, again, their sleep health. So interested in geography, how do the outcomes vary by where they live, rural, urban, somewhere in between, and does it make a difference whether they're involved in these cultural practices? And the photo you see in the back, if you're not familiar with that practice, is smudging. So that's burning sage in this case, and praying and with the eagle feather, or, kind of cleansing your emotions, your energy to, prepare for prayer, to do ceremony, so you can go in with good intentions for the folks that you're caring for. So the next 2 studies I'm working on are continuation of the project I just described. The first is a small pilot study from the INSPIRE program, in which I'm proposing to use community-based participatory research with the tribal community, particularly my own. I've been in contact with folks there for quite a while, just developing using CBPR, community-based participatory research, what is a relevant approach for their needs at this time. And planning to use the same survey questions about cultural practices and human interconnection with the nature to become part of a substance misuse and mental health, particularly suicide prevention work with Native young people. For the second study, I am working on a HIWN proposal. I know Rachel's very close to submitting one as well, so looking forward to her mentorship on that process. But this particularly would be to the National Institute of Minority Health and Health Disparities. And this would be focused on developing an intergenerational environmental health intervention with youth, again, focused on substance misuse and suicide prevention and involving elders, as that's a very important cultural relationship. So I want to say that this is my responsibility as an Indigenous researcher to help tell the stories, not only of the traumas that we have endured and endure, but really of our strengths and the knowledge that our people have that are grounded in their relationships with the land and our many other more than human relatives, not only for prevention of illness and disease, but really, the importance of telling why it's so important that we protect and preserve our lands and waters for all of our more than human relatives, for our own health, as well as that of future generations, especially in light of climate change. So with that, I want to say, Wawana Natanaway Makinak, thank you to all my relatives.